So now that the microorganism has entered into the body, it's attached to the body or the tissue surfaces, and it's survived the host, produced its virulence factors, there's different patterns that this microorganism can take in the body. A localized infection remains confined to one area in the body. The example they give is a boil. You can think of a pimple. If you got a paper cut, that's just bacteria entering into one part of the body. Systemic means body-wide, or it means that it affects multiple organ systems. Systemic infections usually travel through the blood. A focal infection begins in one location and spreads systematically to one or more additional locations in the body. An example would be strep throat. So Streptococcus pyogenes, group A strep that causes strep throat, has the ability to dislodge from the throat, travel through the bloodstream, and colonize the underside of your heart valves, leading to endocarditis. A mixed infection is when you're infected with multiple species at the same time. Any type of bite wound is usually going to be a mixed infection, and any biofilm is automatically a mixed infection. Primary versus secondary infections. So the primary infection is your initial infection. A secondary infection occurs because of the primary infection. So the primary infection kind of makes way for the development of a secondary infection. They give the example of the primary infection being a urinary tract infection, the secondary infection being a vaginal infection. So these are two different microorganisms. One was present, which occupied the immune responses, leading an opening or leaving an open window for a secondary infection to develop. A couple examples of this. Hepatitis D virus can only infect you if you are also already infected with hepatitis B. So if you have Hep B, then you can develop hepatitis D, but without it, you can't. A better example, or one that you've probably more commonly heard of, is HIV. So your primary infection is HIV, which increases the likelihood that you're going to be infected with a secondary pathogen. Passive versus chronic carriers. A passive carrier is never infected. They just transfer the bacteria from one place to the next because they are contaminated, for example, on their hands. So if a person goes to the bathroom and they get some environmental contaminants on their hands from the bathroom and they don't wash their hands and then they sit down to eat their food, they have just passively carried microorganisms to their own food. That's a passive carrier. They're not infected when they're doing this, they're just transmitting it from one location to the next. A chronic carrier is actually infected. They may or may not have symptoms, but they're definitely able to transmit this infection. Typhoid Mary is an example. So in history, Typhoid Mary was known to cause typhoid disease by spreading salmonella through the food that she was preparing. So everyone that ate the food ended up getting salmonella type infections, including typhoid fever. She was an asymptomatic chronic carrier. Didn't have any symptoms, didn't even know she was infected, but she was definitely infecting other people. This can happen in cases of herpes. So if you have genital herpes, you can be shedding the virus without ever having any symptoms. You are a chronic carrier of herpes. There is no known cure for herpes, and they estimate that once you're infected for the remainder of your life. A sign versus a symptom. A sign is something that you can see. So a sign is witnessed by an external observer. You can record fever. You can see septicemia, in other words, organisms multiplying in the bloodstream. You can see microbes in tissue fluids. You can hear the chest sounds, skin eruptions, leukocytosis, leukopenia, so that's an increase or decrease in white blood cells, swollen lymph nodes, abscesses, tachycardia and increased heart rate, antibodies in the serum. These are all things that you can observe on a person. Symptoms are felt by the patient. So symptoms include chills, pain, aches, soreness, irritation, malaise, fatigue, chest tightness, itching, headache, nausea, abdominal cramps, anorexia, sore throat. So sign, think of that like old Ace of Base song, I saw the sign. Anyways, so signs you can see. You can physically observe them on the patient. A symptom is felt by the patient. So now that the microorganism has entered into the body, attached to the host, survived the immune system, started causing damage, it's going to dislodge from the host to go infect the next individual. So now we're going to talk about portals of exit. There's a lot of different portals of exit, and this diagrams some of the most common portals of exit. Vectors serve as a major model for the transmission of infectious diseases. There's biological and mechanical vectors. Biological vectors are actually infected with the microorganism. Examples of biological vectors include when mosquitoes are infected with the Plasmodium parasite that causes malaria, or when the triatomy insect is infected with Trypanosoma cruzi, which causes Chagas disease. So that instance, the microorganism is actually inside and infecting the vector. Another example would be the plague and the fleas. So the flea is actually infected with Yersinia pestis. Mechanical vectors are passive carriers, so they just transfer microorganisms physically from one location to the next. Flies are the best example of mechanical vectors. So flies have a lot of hairs on them, and microorganisms love to stick to the legs and the body parts of a fly. When the fly lands on feces that's contaminated with eggs or cysts of parasites and then lands on your food, it can very easily transmit those, and that's how a lot of people end up getting infected. Zoonosis is the transmission of infectious diseases between multiple species. Zoo, think of like an animal at a zoo. We're usually talking about the transmission of diseases between animals and people. So this table goes through some of the common infections that can transmit between animals and people. But we also have a major concern for the infectious diseases that people give to animals. While working in a zoo, I got to train a lot of the primates and work with orangutans and gorillas and all that type of stuff, and every 6 months I had to get TB tested. If you had a positive TB test, you were not allowed to work with the primates because tuberculosis can infect non-human primates. Another big problem is tourists that go up into the mountains in Africa to try to see wild gorillas. So they go up there and they bring all of their infectious diseases, which for a person, they can just go to like Aurora Quick Care and get some medication to help cure their infection and diagnose it, and we've got all this access to medical care. But gorillas out in the wild, they don't have that. So they end up getting sick with human pathogens, and that can cause a major issue. So not only are they endangered, but people that are going up there to try to see them in the wild to, make some tourist money and that type of stuff, they're really decreasing numbers of these primates out in the wild. So zoonotic infections can be transmitted between different species, and we care about them because we care about the association between transmission from animals to people. Horizontal versus vertical transmission. Horizontal, if you were to draw a horizontal line, that's from person to person. So horizontal transmission is transmission from person to person within a community. Vertical transmission, if you draw a vertical line, that's an up and down line, that's transmission from parent to offspring. And when we're talking about infectious diseases, we're usually talking about from the mother to the developing baby. So vertical transmission from parent to offspring, mother to baby. Horizontal is from any person to any other person. Direct versus indirect transmission. Direct transmission includes contact like kissing, sex. Droplets, so droplet contact, whenever you talk in close proximity to someone, there are droplets of saliva that are coming out of your mouth. And if you're close enough to the next person, they can inhale those droplets directly. That's droplet contact. So that's actually like spraying spit at each other, which sounds really disgusting, but anytime you have a close conversation with anyone, that's exactly what you're doing. needles, insect bites, etc. So that's another form of direct contact. Indirect include fomites. So fomites are left on inanimate surfaces. Food, water, and biological products. So if you eat contaminated food or drink contaminated water, that's an example of indirect. And air is indirect. So that's just anything that's floating around in the air. Other routes of acquiring infections are nosocomial, or healthcare associated infections, or hospital acquired infections. So nosocomial infections are those that are acquired during a hospital stay or visit to a healthcare facility. There's 2 to 4 million cases, new cases each year, and here you can see a lot of them are UTIs. So a big chunk are UTIs, and then we have surgical sites and wounds, respiratory, other types of infections, skin infections, blood infections, and these are some of the most common causative agents. Universal precautions, that's treating everything as if it were highly infectious to prevent the transmission of infectious agents. So we use barrier precautions, needle stick precautions, precautions with dental handpieces, decontamination after hands and surfaces have been contaminated with blood and other fluids. Healthcare workers with active draining skin or mucous membrane lesions must refrain from handling patients, washing hands, frequently using hand sanitizer. So all of those things are practicing universal precautions. While you are wearing gloves, it is possible for the transmission of microorganisms through gloves, and they've demonstrated this numerous times. Gowning is also not 100% fail-proof. So although it decreases the rates of transmission, it doesn't eliminate it completely.